Most people wait for a lab result to tell them something is wrong. A number on a piece of paper, a call from the doctor, a formal diagnosis. That's how many assume diabetes reveals itself. But after more than 2 decades in clinical practice, I've learned something very different. The body rarely stays silent. It speaks early, quietly, and often in ways that are easy to dismiss, especially through the feet. I'm Dr. William Collins, and week after week I meet patients who had clear warning signs long before any blood test confirmed what was happening. The problem is not that the signs weren't there, it's that they weren't recognized. Not long ago, a 67-year-old man came in for what he believed was a routine visit. He felt fine, no major complaints. But when I asked a simple question about his feet, everything changed. He mentioned numbness, something he had brushed off as part of aging. That small detail led us to uncover something much bigger. His blood sugar levels came back dangerously high, and he had likely been living with undiagnosed diabetes for over 2 years. What I'm about to share with you is exactly what I explained to him. These are not rare symptoms. They are incredibly common, yet often misunderstood. And for each one, I want you to understand what people usually assume, what is actually happening inside the body, and what you can start doing today to protect yourself. Sign number 1 is one that almost everyone has felt at some point, which is exactly why it gets ignored. A tingling sensation, numbness, or that familiar pins and needles feeling in the feet. Many people explain it away as sitting too long or crossing their legs. And yes, that can happen occasionally, but when this sensation starts appearing regularly, without a clear reason, it deserves attention. What's really happening here is something called peripheral neuropathy. Elevated blood sugar begins to damage the protective outer layer of your nerves. Think of your nerves like electrical wires covered in insulation. When that insulation is slowly worn down by excess sugar, the signals traveling through those wires become distorted. That distortion is what you feel as tingling or numbness. It's subtle at first, which is why so many people miss it. Nearly half of people with diabetes experience this at some stage, and it almost always begins in the feet. A simple habit can make a meaningful difference here. A daily walk, just 20 to 30 minutes, helps improve circulation and supports nerve health. At the same time, reducing added sugars in your diet can begin lowering the stress placed on those nerves. Sign number 2 is often described as one of the most uncomfortable experiences, especially because it tends to appear at night. Patients tell me their feet feel like they are burning when they lie down, even though nothing external is causing it. During the day, distractions may keep it in the background, but at night, it becomes impossible to ignore. This burning sensation is another form of nerve dysfunction. The nerves, already affected by high blood sugar, begin sending incorrect signals to the brain. It's like a faulty fire alarm going off without any real fire. The sensation of heat is real, but it's being generated internally by damaged nerve pathways. Studies have shown that this type of discomfort can appear years before a formal diabetes diagnosis. That makes it a powerful early warning sign if you know how to interpret it. There are 2 simple daily habits that can support your body here. Staying properly hydrated helps your kidneys process and remove excess glucose more efficiently. At the same time, increasing fiber intake through foods like vegetables, legumes, and oats slows the absorption of sugar into the bloodstream, reducing the spikes that contribute to nerve damage. Sign number 3 is where things begin to shift from uncomfortable to potentially dangerous. This is the sign that often leads people to urgent care or the emergency room, usually after it has already progressed further than it should have. It starts with something small, a blister, a minor cut, or a sore from a shoe. Under normal circumstances, these heal quickly, but when blood sugar remains elevated, the body's ability to repair itself becomes impaired. High glucose levels cause blood vessels, especially the tiny ones in the feet, to become stiff and narrowed. This reduces the delivery of oxygen, nutrients, and immune cells needed for healing. Imagine trying to water a garden with a hose that's bent and restricted. The water is there, but it can't reach the plants effectively. The same thing happens in your body. As a result, even a small wound can remain open, becoming vulnerable to infection. This is not something to take lightly. Many serious complications begin this way, quietly, with something that seemed minor at first. That's why I give this same advice to every patient. Take a moment each day to check your feet. Look carefully, even between your toes. If you notice any cut, blister, or area that isn't healing, clean it gently, protect it, and monitor it closely. If there's no improvement within 48 hours, don't wait. Seek medical attention. Your body is always communicating with you. The key is learning how to listen before those signals turn into something more serious. What many people don't realize is that some of the most important warning signs are not hidden at all. They are visible, right in front of you, showing up day after day in ways that feel easy to explain away. But once you understand what to look for, those small changes begin to tell a much bigger story. Sign number 4 is one of those signs that hides in plain sight. Patients often tell me they've noticed a change in the color of their feet or ankles, maybe a darker tone, a reddish shade, or even a slightly bluish tint. Most assume it's just sun exposure, aging skin, or something they've always had. And sometimes that's true. But there is a very specific pattern of discoloration that immediately raises concern when I see it. What's happening underneath the surface is a circulation issue. When blood sugar remains elevated over time, it begins to damage the blood vessels, especially the smaller ones that reach the extremities. Your feet, being the farthest point from your heart, are the first to feel the effects. The skin changes color because it is no longer receiving enough oxygen-rich blood. I often explain it like this. Your blood is like a delivery system, carrying oxygen and nutrients to every part of your body. Your feet are at the very end of that route. When the pathways narrow due to damage, deliveries start arriving late, or not at all. The skin, deprived of what it needs, begins to change in appearance. It's a visible signal that something deeper is happening. Research has shown that these types of skin changes can appear well over a year before a formal diagnosis is made. That gives you a window of opportunity, but only if you recognize it. A simple daily habit can help here. Spend just a few minutes each morning doing ankle circles, toe raises, and gentle calf stretches. These small movements improve circulation significantly, and if movement is limited, even elevating your feet slightly while sitting can support better blood flow. Sign number 5 is one that surprises almost everyone because it seems so harmless. Dry, cracked heels are incredibly common, especially in colder months. Most people treat it as a simple skin issue and move on. But when those cracks become persistent, deep, or resistant to moisturizers, even in warm weather, it points to something very different. This is where the autonomic nervous system comes into play. These are the nerves responsible for automatic functions in your body, including regulating moisture in your skin. When these nerves are affected by high blood sugar, your sweat glands stop working properly. The skin begins to dry out from the inside, not just the surface. You can apply lotion over and over again, but if the underlying nerve function is impaired, the problem won't resolve. It's like trying to fix a wall by painting over it when the structure underneath is crumbling. Eventually, cracks appear, and in the case of your feet, those cracks can become entry points for infection. I've seen patients with heel cracks so deep they were bleeding after trying every moisturizer available for years. That's not just dry skin. That's a sign the nerves are under stress. The best approach here is consistent care. Moisturize your feet every night, focusing on the soles and heels, but avoid applying lotion between the toes where moisture can become trapped. At the same time, make sure you're hydrating your body from within. Your skin depends on internal hydration just as much as external care. Now, before we continue, I want to pause for a moment. We've already gone through 5 signs, and I want you to think honestly about this. Have you noticed any of these changes in yourself or in someone close to you? A parent, a partner, a friend? If even one of these signs sounds familiar, take a moment to acknowledge it. Awareness is always the first step, and if this information is helping you see things more clearly, take a second to support the message. It allows this kind of information to reach more people who may need it just as much. Let's continue. Sign number 6 is where the conversation expands beyond the feet themselves and starts involving another critical system in your body, your kidneys. Many people notice swelling in their feet or ankles and assume it's simply from standing too long or sitting for extended periods. And yes, occasional swelling can be normal, but when it becomes consistent, noticeable, and leaves marks, like deep impressions from socks, it deserves closer attention. What's happening here is fluid retention, also known as edema. Over time, elevated blood sugar can damage the kidneys, which are responsible for filtering waste and maintaining fluid balance in your body. When that system becomes impaired, fluid begins to accumulate, most visibly in the lowest parts of your body. Imagine your kidneys as a filtration plant. Every drop of blood passes through them to be cleaned and balanced. When those filters are damaged, the system starts to back up. Excess fluid has nowhere to go, and gravity pulls it downward into your feet and ankles. One of the most telling signs is something called pitting edema. When you press your finger into the swollen area and the indentation remains for a few seconds, that's your body showing you that fluid balance is off. This is not something to ignore. It's often one of the earliest visible indicators that kidney function is under strain. There are simple steps you can take to support your body here. When resting, elevate your feet slightly above heart level to help redistribute fluid. Reducing sodium intake can also make a significant difference, as excess salt causes your body to retain more water. And most importantly, if this swelling is new, persistent, or worsening, it should be discussed with your doctor. Early attention can prevent much more serious complications later on. Your body continues to send signals. The question is whether we choose to recognize them while there is still time to act. There comes a point where the signals your body sends are no longer subtle. They become harder to ignore, but unfortunately, they are also easier to misunderstand. And that's where many people lose valuable time. Sign number 7 is one of the most commonly misdiagnosed, especially in men. I hear the same story over and over again. I've been taking ibuprofen for months. I thought it was arthritis, maybe an old injury, and sometimes that assumption is correct, but other times, the pain has nothing to do with joints or muscles at all. When nerves are damaged by prolonged high blood sugar, they don't always go silent. In many cases, they do the opposite. They become overactive, sending intense random signals to the brain. Patients describe this as sharp, stabbing pain, electric shocks, or a burning needle sensation in the foot. It often appears at night when everything is quiet and there's nothing to distract from it. I like to explain it this way. Imagine a car alarm that was damaged in a minor accident. No one is touching the car, but the alarm keeps going off anyway. That's what a damaged nerve does. It creates a false alarm. The pain is real, but it's not coming from an external injury. It's coming from a malfunction in the nerve itself. This is why medications like ibuprofen don't solve the problem. They may dull the sensation temporarily, but they don't address the underlying cause. And when you mask that signal, you delay the moment when your body is asking for attention. Research has shown that this type of nerve pain affects a significant portion of people with diabetes and is often mistaken for more common conditions like arthritis. A simple daily routine can help support your nerves here. Before getting out of bed each morning, take 5 minutes to gently stretch your feet and ankles. Flex them, rotate them, and wake up the circulation before placing weight on them. At night, a light massage along the sole and up the ankle can help calm those irritated nerve pathways. Sign number 8 is the one that tells me the condition has likely been developing for a longer period of time. It's something many people have experienced for years, which is exactly why it gets overlooked. Cold feet. At first, it sounds harmless. Many people joke about always having cold feet, especially in winter. But when I ask a few follow-up questions, the picture changes. Are your feet cold in the middle of summer? Are they cold even under blankets? Do they stay cold while the rest of your body feels warm? When the answer is yes, that's when concern begins. Persistent cold feet are often a sign that blood flow to the lower extremities is significantly reduced. The blood vessels have narrowed or stiffened to the point where warm blood simply cannot reach the feet effectively. Think of your circulatory system like a heating system in a house. Warm air is supposed to travel through ducts to every room, but if those ducts become narrow or blocked, the farthest rooms stay cold no matter how much heat the system produces. Your feet are those far rooms. This isn't about the temperature around you. It's about the condition of the pathways delivering warmth. Conditions like peripheral artery disease, which are strongly associated with long-term high blood sugar, often begin with symptoms like this. The good news is that circulation can be supported with consistent movement. A brisk daily walk, something intentional, with steady pace and arm movement, can make a meaningful difference over time. Even starting with 10 minutes a day is enough to begin. Sign number 9 is the quietest of them all. It doesn't cause pain, it doesn't create discomfort, and because of that, it's one of the most overlooked signs I see in practice. It's the gradual loss of hair on the lower legs and the tops of the feet. Most patients don't notice it until I point it out, and when they do, they're surprised. I never paid attention to that. Exactly. That's why it matters. Hair follicles depend on a steady supply of blood and oxygen to function. When circulation becomes impaired over time, those follicles begin to receive less and less of what they need. They don't disappear overnight. They simply stop producing hair. I often compare this to plants in a garden. If the irrigation system begins to fail, the plants don't immediately die. They just stop growing. Over time, the absence of growth becomes noticeable. That same principle applies here. The absence of hair is not just cosmetic, it's a visible indicator of reduced blood flow and vascular health. Studies have shown a strong connection between hair loss in the lower extremities and underlying circulation issues in individuals with long-term elevated blood sugar. It's a small detail, but it carries significant meaning. After hearing this, I want you to do something simple. Take a moment today and look at your lower legs and the tops of your feet. If you notice that hair is significantly thinner or absent compared to the rest of your leg, that's worth paying attention to. A simple blood glucose test can provide clarity, and it's one of the most accessible and affordable tests available. We've covered a lot together. 9 signs, 9 opportunities to recognize what your body may already be trying to tell you. One of the most difficult moments in my work is sitting across from someone who has experienced several of these signs for years without understanding their meaning. Not because they ignored their health, but because no one had ever explained what to look for. Now you have that knowledge. So here's what I want you to do. Tonight, before you go to bed, take just 30 seconds. Sit down, look at your feet carefully. Check the skin, look between your toes. Notice how they feel. That small habit can make a bigger difference than you might imagine. And if you recognize even one of these signs, don't delay. Reach out to your doctor. Early awareness creates options. It allows for simple, manageable changes, adjustments in diet, daily movement, and proper medical guidance that can protect your health long term. You've worked hard to maintain your independence, your energy, and your quality of life. Don't let something manageable take that away simply because it went unnoticed. If this message helped you see things more clearly, share it with someone you care about. A friend, a parent, a neighbor. You never know who might need this information today. And if you want to continue learning in a practical, honest way about your health after 60, stay connected here. I share what I see in real patients, the conversations that often don't happen outside the clinic. I'm Dr. William Collins. Stay aware, stay proactive, and take care of your feet. I'll see you in the next video.